In this video, we're going to talk about 10 early warning signs that might mean you have dangerous blood clots in your body. Your body usually makes and gets rid of blood clots all day without any problem. But sometimes these clots don't break down like they're supposed to and can get stuck in your blood vessels. When that happens, blood can't flow properly to and from your heart, which is a big problem. This can cause really serious issues, such as heart attacks, strokes, or something called an embolism. An embolism is when a clot breaks free and ends up blocking a blood vessel in your lungs. If you notice any of the signs we're about to discuss, it's really important to talk to a doctor as soon as possible. Just remember, this video is meant to teach you something new and should not replace advice from a doctor. If you're worried about your health, make sure to see a doctor. Here is a guide on the top 10 early signs of blood clot. 1. Leg swelling. Swelling in a limb, typically in one leg, is often one of the first indicators of deep vein thrombosis, DVT. The leg may feel unusually heavy or tight, and this sensation can make activities like pulling on a sock or shoe challenging, as bending the leg could be painful. Such swelling is often noticeable when one leg appears significantly larger compared to the other. DVT occurs when a blood clot forms in a deep vein, most commonly in the lower leg. If this clot becomes detached from the vein and travels through the bloodstream to the lungs, it can lead to a pulmonary embolism, an extremely urgent medical emergency. The swelling caused by DVT is usually unilateral, affecting just one leg. In some cases, the swelling can extend from the calf up to the thigh, depending on where the clot is located. Recognizing this symptom early is crucial, as prompt medical treatment can prevent the clot from moving to other parts of the body, thereby averting more severe complications. 2. Pain or tenderness in the leg, particularly in the calf area, can manifest in various ways, often described as cramp-like or sore. This discomfort is a notable symptom that may indicate the presence of a blood clot, medically referred to as deep vein thrombosis, DVT. It's crucial to recognize that the pain associated with a potential blood clot typically intensifies when standing or walking. This discomfort does not subside even during periods of rest, setting it apart from ordinary muscle pain that often eases with relaxation. Additionally, the pain may exacerbate with an increase in dorsiflexion, a movement that involves pulling the toes toward the shin, which can stretch the calf muscles and possibly aggravate the area affected by the clot. This symptom is often more troublesome at night, possibly due to the decrease in physical activity and the position of the legs while lying down, which can affect blood flow and exacerbate discomfort. 3. Red or discoloration of the skin on the leg can be a significant indicator of an underlying medical issue, such as a blood clot. When a clot obstructs the flow of blood, it can cause changes in skin coloration, with red being one of the most common hues observed. However, it's not uncommon for the skin to also exhibit shades of blue or purple, indicating varying degrees of oxygen deprivation and blood pooling. This discoloration is typically localized, affecting specific areas where the clot is present or where circulation is compromised. If you find these tips helpful, we encourage you to show your support by liking this content, subscribing to our channel, and enabling notifications for the latest health and nutrition tips. 4. Warm in the area of the clot. When you feel warmth in an area that might have a blood clot, it's something you shouldn't ignore. This warmth, which you can feel more in one spot than in others, happens because more blood is flowing to that spot and the body is trying to fight off what it sees as a problem. Blood clots in a vein can mess up the normal flow of blood, causing blood cells and fluid to pile up. This pileup makes the body start a process called inflammation to try and fix the issue. Inflammation is the body's way of responding to things that could harm it, sending extra blood and immune system helpers to the spot, making it warm, swollen, and sometimes changing color. Moreover, the skin over the clot might appear shiny or tight, which reflects the underlying inflammation and swelling. As the area swells, the skin stretches to accommodate the increased volume caused by the fluid buildup, giving it a shiny appearance. The tightness is a direct consequence of this swelling, as the skin and surrounding tissues are stretched beyond their usual capacity, creating a sensation of tension and discomfort. 5. Breathlessness. Breathlessness, especially when it comes on suddenly and seems to get worse when you're doing something strenuous, can be a key sign of something serious, like a pulmonary embolism. This is when a blood clot finds its way to your lungs. Struggling to breathe properly out of nowhere is not something to take lightly. It's your body alerting you to a potentially life-threatening situation. Pulmonary embolism can quickly become dangerous, leading to severe health issues or even death if it's not treated right away. So, if you find yourself suddenly gasping for air or unable to catch your breath, especially if it happens suddenly and gets worse with activity, getting medical help as soon as possible is critical. Ignoring this symptom, thinking it might just go away on its own, is a risk you shouldn't take. 6. Chest pain. One of the central symptoms of pulmonary embolism is a sharp pain in the chest that escalates when taking deep breaths. This pain may radiate to the shoulder, neck, or jaw, increasing concern among individuals. Due to the potentially fatal nature of pulmonary embolism, such cases require prompt medical care. People might experience a tightening or squeezing sensation across the chest area, along with sharp pain, which can be easily mistaken for a heart attack. The pain may at times be so intense that it interferes with daily activities and causes the patient great distress. 7. Rapid heartbeat. A sudden rapid heartbeat, particularly when accompanied by symptoms such as shortness of breath or chest pain, is often an indication of a blood clot in the lungs. This increased heart rate is the body's reaction to a diminished supply of oxygen, necessitating the heart to work harder to distribute blood. In addition to tachycardia, the individual may experience palpitations, where the heart feels like it's racing or fluttering. A rapid heartbeat can be typical of various cardiovascular diseases, including pulmonary embolism, and early diagnosis and timely treatment are essential to prevent severe complications. 8. Dizziness or lightheadedness. Feeling dizzy or lightheaded can be a sign that something serious is going on, like a pulmonary embolism. This is when a blood clot blocks one or more of the arteries in your lungs. These clots usually start in the veins of your leg or pelvis. When these clots block blood flow in the lungs, it makes it hard for your lungs to put oxygen into your blood like they normally do. This means less oxygen gets to your brain, which can make you feel dizzy or lightheaded. It's a big deal because it shows that your brain isn't getting enough oxygen, which is a sign that you could be dealing with a pulmonary embolism. The sensation of dizziness in the context of pulmonary embolism may also be accompanied by other symptoms, such as sweating and a loss of balance. Sweating may occur as the body's response to stress, or as a symptom of the underlying hypoxia, low oxygen levels, while a loss of balance can be a direct consequence of the brain receiving insufficient oxygen. These symptoms, especially when they appear suddenly, are red flags indicating that the body is under distress. 9. Coughing up blood, especially if it's pink and looks bubbly, is a serious sign that something is wrong and you need to see a doctor right away. Seeing pink, bubbly spit when you cough is really worrying because it means there might be bleeding in your lungs and too much fluid building up. This could be a sign of pulmonary edema, a problem where your lungs fill up with extra fluid. This can happen if your heart can't pump blood properly because of a blockage. This makes it hard for your lungs to do their job of getting oxygen into your blood and getting rid of carbon dioxide, which is why your spit might look pink and frothy. If you're coughing up blood and also find it hard to breathe or hear a wheezing sound, it's a serious sign that you need help. Wheezing means your airways are getting narrow, maybe because they're swollen, filled with fluid, or blocked, which makes it tough to breathe. Having trouble breathing, like feeling short of breath or breathing really fast, shows that your lungs aren't able to get enough oxygen to your body. 10. Feeling anxious. Feeling suddenly anxious or nervous for no obvious reason can actually be your body's way of reacting to a problem like a blood clot. Even if you don't know what's wrong, your body might be sensing that something's not right inside. Blood clots can mess with how blood flows around your body and even threaten important organs, causing your body to freak out a bit. This can make you feel scared or nervous because your body is trying to get you to notice and do something about it. This worry might come with a strong feeling that something bad is going to happen, even if you can't put your finger on why. This can be really scary, especially when you can't see any reason to feel this way. When your body is stressed like this, it can make your heart beat faster, make you breathe quickly, or cause you to sweat. These are all ways your body gets ready to deal with danger, known as the fight or flight response. When it comes to blood clots, like those in your legs, deep vein thrombosis, or in your lungs, pulmonary embolism, your body might be reacting to not getting enough oxygen because of the clot. For instance, if a clot is blocking an artery in your lungs, it can make it really hard for your lungs to get enough oxygen into your blood, which could set off this whole stress response, making you feel super anxious or nervous. Risk factors for blood clots include prolonged immobility, certain medical conditions like cancer or heart disease, smoking, obesity, and family history. Preventive measures include staying active, maintaining a healthy weight, avoiding smoking, and following medical advice regarding blood thinners or compression stockings if at high risk. Recognizing early warning signs of blood clots can be crucial. If you experience any of these symptoms, especially if they are sudden or severe, seek medical attention immediately. Early diagnosis can prevent serious complications. Thank you for watching Top 10 Early Symptoms of Blood Clots. Don't forget to like, subscribe, and turn on notifications for more health-related content. See you in the next video.